You're tuned into the Advocai Health Podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real.
Hey everyone, and welcome back to another episode of the ASH podcast, the show where we break down complex healthcare issues and explore how they intersect with advocacy, ethics, and innovation. Today, my co-host Omar and I will be talking about the lasting effects of COVID-19 on our healthcare systems, from workforce shortages to surgical backlogs and even mental health strain among providers. The pandemic left us all with deep scars, and many systems are still struggling to recover. So let's dive in.
All right. So let's actually just set the scene first based on what has happened in the past few years. I know it's been a while and maybe we need a bit of a refresher. But so let's rewind for a second. In early 2020, healthcare systems basically everywhere faced something they've never really prepared for. Hospitals were overwhelmed, ICUs were filling up with a bunch of patients. There was a lot of PPE shortages as well. And suddenly everything non-urgent, like from stuff like knee replacements to cancer screenings, even diagnostic procedures, they all got pushed aside.
Yeah, and a lot of those delays are still like haunting us, right?
Yeah.
Everything is still getting pushed. Everything's still the backlog is still being gone through. I mean, surgeries in Canada, I think 68% of hip surgery replacements got their procedure within the recommended 26 weeks of 2024. So this is still like quite recent when you think about the pandemic. Although it started in end of 2019 or early 2020, I would say lockdown wise, it lasted for about the entirety of 2020. By 2021, things had opened up. And so when you compare that, the fact of surgery or replacements only, a limited amount of them actually having or being on a timeline. Again, I'll restate just the statistic, which is 68% of hip replacements were on time or on this timeline in 2024. That used to be 75% in 2019. So we went from, 75% or like 70% in the 70s to low 60s. That's, if you think about it, thousands of patients waiting, potentially in pain, potentially in growing discomfort, getting worse and worse and worse for I don't know how long.
No, it's really, really bad, and you don't really get to see the impact until you hear the numbers. And I think the numbers have been forgotten too, because people are trying to move away from this past trauma. But the reality is that there's some people who are just suffering from those long-lasting effects of a pandemic, and especially cancer surgeries too. That was a huge point. For example, prostate operations, they now take 9 days longer on average than before the pandemic. So it's not just like the pandemic has long-lasting effects. It's kind of changed the way the influx of like procedures and screenings happen, and that's become an unfortunate norm for those type of procedures. Even for breast, bladder, and lung cancers, weights are obviously also up. And that backlog isn't just numbers, it means late diagnosis, longer suffering, and sometimes even worse outcomes. And I can even relate to that personally with my mom, right? When she had her cancer diagnosis, the delay is going from what could have been a 2-3 month wait to a 13-14 month wait. It has an impact on people and families. So
especially when cancer is can be such an aggressive progress, right?
Absolutely.
From any day, one thing could go from like stage 1 to stage 3, stage 2 to 3, and so on, and you're having months and months of the wait. That's insane to me. And I know that the backlog or like the issues we faced like directly because of COVID mattered, but then these are so many other things that I think just got pushed to the side. It's not even just procedures. There was like a whole crisis in like workforce, right? So wait times with patients were crazy, but people delivering the care were also suffering. So because of COVID, because of limited resources, because of needing to socially distance, which meant less patients actually being in hospitals because you couldn't keep them next to one another, these type of things. It burned out workers. And I think there was a recent survey that found that I think 45 or like 45.4% of frontline physicians in Canada were reporting burnout, which is nearly half. Like nearly
Mm,
half the
yeah.
physician force of Canada is reporting a burnout. That's, I mean, that's a bit insane. That's
Yeah.
we need more help for physicians. I mean, we need more physicians, which I think is a
Yeah,
topic
that's
we've
one
had
thing.
before as well. But I don't know. Give me your thoughts on that.
Yeah, no, no. It's crazy because like that's like one statistic of like a survey, but then if you break it down to specialties too, we already know primary care is like overburdened. So
Yeah.
like imagine they did a survey just on primary care, which I think might exist out there, but the point is that like even like hotspots in different specialties were already burning out, and now a
Hmm.
pandemic came and like quality control and all those things may have taken a longer time than expected. So now frontline physicians, people who are the gatekeepers of our care, are actually just suffering immensely, as much as maybe even the patients, to be honest. Like patients come and walk in, but they don't even know what physicians are going through too. And it's not really their concern. Obviously they're coming with their health concerns, but it's
Yeah.
just that you can't have both sides suffering. And that's how is a system, how do you even call that a system, right? So
Yeah.
that's a big problem. And in Ontario alone, we have more than 2,700 healthcare workers self-referred for mental health supports during the first 5 waves. So stuff like anxiety, depression, PTSD, these weren't mild stress cases, and these were like serious things that are looked at seriously. But because of the self-referral and all the burnouts, the outcome was this.
Yeah. I mean, it is weird. I wonder, this is just like a thought that while you were talking, like I wonder if there were patients who maybe not like consciously, like unconsciously felt at times that, okay, maybe my problem is not big enough to go and
Oh
bother
yeah,
like
yeah.
healthcare
That
workers who are busy. Like, I mean, I'm
yeah.
sure there's so many patients who were like needed care, needed help, and maybe they were like, okay, maybe it's not bad enough to actually bother staff who are burnt out, because at the end of the day, all of these burnouts lead to more like shortages in staff,
Hmm,
right?
hmm. Yeah,
A Statistics Canada survey, I think, showed that 18% of healthcare workers are considering leaving or changing jobs within 3 years. And
that's
this was
crazy.
in 2022. So there's a chance people did in the last 3 years, because it's now 2025. That's
Yeah.
losing like one out of every, I don't know, five nurses or doctors in the middle of a crisis. And when you hear that as someone who's potentially a patient, you're like, maybe my problem isn't that bad. I can like get some Advil, get some, uh,
Yeah.
Tylenol, get something that'll fix it or like keep me fine, so that potentially I don't cause more burnout for these doctors who then, leave, and then people actually need them are
Yeah.
suffering because of that. So these are like, there's, aside from all the actual, I think front face effects, there's like underlying, maybe unconscious effects that also go into this whole
Mhm.
crisis, right?
Yeah. I mean, that's like a moral dilemma that a patient shouldn't have, to wonder if they
Yeah.
should actually even go to a doctor just because they're worried it may make things worse for them or the system. Like, that should not be their concern. The system should be ready for them. And at the
Mhm.
same time, also, physicians should have like stuff in place that ensure that they're able to do what they need to do. So, pandemic is really that unfortunate situation where both ends just struggle, and the lasting effects are, as we see, based on all these stats and people leaving, patients being delayed for care. Like it's all happening, and it's kind of quiet down now, but like they still like go through this in behind the scenes. And let's talk like dollars now, like financial strain, and like how it's actually affected a system that was already kind of fragile, but now it's
Yeah.
becoming broken. Hospitals themselves have lost billions of dollars when elective surgeries were canceled. And maybe not a lot of people know this, but those are usually the financial lifeline of those hospitals. When they bill you for those surgeries, that's how they actually support their system financially. How maybe even salaries are paid for quality assurance. Like there's so many things we can't even like list them in this episode. And even today, our economy itself has taken a hit from the pandemic. So
Yeah.
we all know about it, like the higher wages, supply chain costs, pandemic debt. They're all squeezing the budgets, and we're already having like strain on the economy. So now you have the healthcare system, which actually, if you think about it, like when the economy is in strain, people are stressed, and that the first place to go will be the healthcare system, right? Because logically, you're stressed about what's going on. But the thing is that the healthcare system's also in stress now. So like, who's
Who do
treating
they go
who at
to?
this point, right? It's like it's a very confusing situation, and yeah, that's one thing to consider.
Yeah, no, and just to preface for anyone listening, like we're also not just talking about like we're not just talking about Canadian healthcare system. We're talking like thinking worldwide as well.
Yeah,
So
yeah.
that's why elective surgeries are really important also in countries that don't have the type of healthcare system that Canada has. So, for example, U.S. a lot of their elective surgeries are then used to create funds that hospitals can use to do pro bono or free surgeries or free procedures when needed. I understand
Mm-hmm.
also that the US has a very different financial system for healthcare. So I don't want to go too much into it because that could be a
Yeah,
whole separate topic on whether or not we think that's right or
note it
wrong.
down.
What's I think that's our that could be our next current events episode
Maybe,
about like
maybe.
different healthcare systems and
Mm,
which one works better for where and
yeah.
whatnot and compared to worldwide. I think that'd be fun. But
Mm,
yeah, no, I think the point about financial is like while governments stepped in with emergency funding and they tried to
mm-hmm.
do their best, try to like fund everything,
Mm-hmm.
systems are fragile. It really does depend on what governments can do, and obviously in the Western world and in developed first world nations,
Yeah.
governments can spend more on those type of things because they have the money, right? Canada
Mm-hmm.
did really well with that. The US got control over its well, US arguably ended up having like the most COVID cases, but we're
Mm-hmm.
all controlled really well because of like vaccines and the healthcare that they could provide. So
Yeah.
then it didn't really amount to much in terms of like deaths, or at least for COVID, and then that helps with containing other things. But even like UK, Europe, they quarantine. They have like Europe, I think also has, or like Canada, one of like the better healthcare systems in how they treat patients
Yeah.
and financially. So these places have the funds, they have the GDP and whatnot
Mm-hmm.
to give that support. Versus like developing nations, they couldn't really do that.
Not really. Yeah.
Right. So a lot of countries, I feel like, also had so many other big problems that they're just like, well, I mean, COVID doesn't matter. We have whatever, everything else is already killing us. Which
Yeah.
is a really bad thing to go about. But when you think of the fact that some governments could step in, some governments could not, the demand for care, especially with aging populations, right, is climbing way faster than the workforce or hospital capacity can really keep up. And that's a
Mm-hmm.
concern.
Yeah, absolutely. So like, I guess the way to sum this whole thing up is that the pandemic didn't just expose weak spots and those cracks that were already there, it just deepened them further. And now for some of us, we're kind of seeing it for the first time, which is true. But
Mhm.
for those that knew that they existed in the first place, it's just like, oh my god, this is the worst thing that could have happened. And
Yeah.
yeah, it's bad.
Yeah, no, to go on a bit of a tangent, it kind of comes into like, I don't know if we plan to talk about this later, so I apologize if I bring it up now. But it's not a secret that the world didn't plan or doesn't have a plan for a pandemic. Like worldwide, governments
Mhm.
didn't really know what to do. Everyone was in a
Yeah.
panic state. No one, I think, thought it would get that big.
Yeah.
Um, I think everyone thought it'd be quite contained. Like we've had epidemics before in the like recent history.
Yeah.
Obviously, there have been pandemics worldwide in human history, but we're at a different stage technologically right now
Mm.
that and medically that I don't think anyone thought that, oh, this could happen. Which I don't know if I should say this, but does that feel like it came out of like a level of ignorance or level of like arrogance, like, or just
Mm.
not caring? Like, give me your thoughts. Like, do you think governments or worldwide people thought like, okay, surely it won't, because we know more and we're at a better level. That just
Mm.
there's no way we'll let it get that bad, or there's no way this could happen to us now, or they just didn't think of it as a priority.
It's a really tough question, and I think it really depends where you stand. Like, if you are, let's say, a citizen, right?
Hmm.
And you see the effects and, it's disrupted your like personal life and everything like socially, then I think one would say it's out of like, maybe both ignorance and arrogance. But those who are on the top and who knew what safeguards were in place, who knew what efforts were put in, obviously every country did a different type of effort at a different level. I don't think everyone kind of was on the same page. That's why it was not contained as well. So yeah, like I think depending on the country, the government, and the people, it could be seen in different ways. But definitely there's an element of ignorance for sure, because like some things were just really taken easy, especially by like in the political world as well. Like they didn't really take it as a serious concern. They were, especially like in the western side, right, of the world, they were like, oh yeah, it's on that side, we'll communicate and public health will intervene and get involved, but we are ensuring our people that this is not coming here. But also there's immigration and there's travel, there's it's the main outsource for spreading disease. And I think news reporting was also a huge problem. Not to go on a tangent about that, but that's a thing to mention, that when the news wasn't reported on time, by then God knows how many people actually immigrated or left the source country, came here, and have already spread it across airports, across like terminals, cities. It started spreading. So like unless there was like real-time information that allowed everyone in the world to kind of know that, hey, this has been alerted and we should like immediately put lockdown. Like I feel like lockdown should have been way early. If they did it really, really early, it would have been temporary. But because they were late in everything, it became almost permanent for 2 years. So that's my take.
I agree 100%. I think lockdown should have been earlier. I think getting people to adhere to lockdown was also a pain in the Western world.
Don't even get started.
And surprisingly, although it's kind of where everything originated from, China did really well at like capping their number of cases. Now, okay, I know that there are maybe people and thing of like, okay, countries may not have reported the correct number of cases, they may have hid facts. Possible. I'm not gonna speculate that it did or did not happen. We don't know. I'm gonna go off of the facts or that we have been given. But China did well at capping the number of cases that they had. Europe did fairly decent at that, especially because they had a huge loss in terms of tourism. Like Europe, I think, is still recovering in terms of tourism, which is also why right now, if you go there, there's like so many tourists because for like I think 2 years people couldn't really go. Like they missed out. That's in like the entirety of Europe, that's like their main like funding. That's where they get majority of their money. So for them also, healthcare wise, that takes a huge hit because how do you fund a healthcare system when you don't have the funds? Even though you're a world superpower and you are like a not nation but leading area of the world, you were funded by tourism because that is their main attraction. That is how it works. And so that again is another hit that like these things take because everything was so delayed and then got pushed on so long. But aside from all the negatives that came from COVID and all the issues that we did have, and I think still somewhat do, it wasn't all bad, right? So it forced this revolution in how healthcare is delivered. It forced us to make changes. We got a more developed form of telemedicine. These things exploded overnight. Patients went from, would you trust a video doctor or like, would you trust doing a phone call appointment to a doctor, is like, to now, why would I possibly want to drive across town when I can do this from home? And that's not just even like doctor, but that's also work. Like people now working from home, they don't want to go back. And I think COVID gave that. Before that, there wasn't really as much of an option of work from home, but definitely telemedicine has been, it's been huge.
And I think it's one of the greatest silver linings of this whole pandemic, although it's hard to hear the word pandemic and silver lining, but it does exist. And the acceleration for telemedicine was insanely wild. Like in some provinces, virtual visits jumped from less than 20% of appointments to now over 70% at the pandemic peak. And it hasn't even gone that much down. It's kind of still like in the high like 50s and 60s based on a source that I read last night. And really the challenge now is keeping that momentum. Like we don't want it to decline further, because although not everyone would benefit from a virtual visit. There are some communities, like rural communities, low income communities, older patients, that aren't left out of that digital shift. We got to ensure that they have some touch to technology. But just people who can't make it, right? Like some people just can't make it to the hospital. They can't afford like all those systemic barriers, like facing those systemic barriers in the first place. So virtual care was their touch point. It was the way to get access to care in a timely manner and just ensure that everyone has access to it. So yeah, that to me, to this day, whenever I look back at the pandemic, I think about the positives, and this is the first one that comes to mind. It really is just telemedicine.
Yeah, I think telemedicine has been huge. I myself remember that like having telemedicine appointments during that time, like having phone call appointments.
Mm-hmm.
And I'll be honest, there was a time or two after, I think 2021, 2022, when I had like a very minor issue, and even I asked my family doctor, can it just be a phone call appointment?
Mm-hmm.
And I think someone on the other end had said that, we don't really do that anymore.
Yeah.
Which I was like,
Interesting.
okay, yeah, fair. I get, because I'm not 100% sure, but I feel like obviously with a phone call appointment, the pay for the family doctor is less, or it's like something is.
I personally don't know, but they do charge a telemedicine fee, right?
They do, but I feel like, because I did a volunteer thing in a clinic once, where I remember like having to go through the financial errors and stuff like that, and I remember something about like, oh, this. I was like, this doesn't seem right. She's like, oh no, that's because it was a phone call appointment, so it'll be like something less or something like that. So I feel like that's another thing, clinic wise, like they wouldn't want to if they're getting paid less to do that, which I get it, I guess, because we've gone over the topic of everything being a business. But at the end of the day, telemedicine, great thing we had, a huge way to like help people from home, especially from like the smaller things, the everyday regular things. But it doesn't replace the surgery. It doesn't replace a test that needs to be done. But it can cut down on those missed appointments, help speed up things, and make things more accessible for specialists and family doctors. So I think there's definitely something to hold on to for that if you're going forward in the smaller cases, at least.
Yeah, I agree. It's definitely something that we should all reflect on and ensure that we kind of maintain, because it's helping the system, not making it worse. And just quickly, something we wanted to touch back on as well is thinking about like the public health sector, which I think is really important to emphasize as well. And something we really don't talk about enough in that area is routine preventative care. That really took a huge nosedive during COVID, and in some parts of Canada, like talking about cancer again, cancer screening volumes fell as much as 40% in 2020. And it's not just about like what happened in the pandemic, but afterwards too. Even if like everything's open, the mentality that people have picked up of doing less screening may be implicit, right? It may be something that they continue to do, and now it's just something that we have to maybe educate again to the public that screening is important.
100%. And like recovery has been uneven, right? In Ontario, I think breast cancer screening, it dropped, like I said, from like 61% of women being up to date in 2019 to like 2% in 2022. I mean, it doesn't seem like a lot when you just look at the numbers, but that percentage, when you go to the population of women in Canada, that's quite a bit. Colorectal screening also slipped 66% to 62%. And this is from a source in 2023, so it's slightly more recent. That means, cancers are being found later, which, as we kind of mentioned, makes treatments harder, worse for the patient. That could lead to a worse prognosis.
Yeah, absolutely. And cancer is that one area where like even just a few percent drop is like a huge problem, especially for specialists, right? So even though like the acute phase of the pandemic has really ended by now, the health impacts are still rippling forward in many areas, such as chronic disease complications, in misdiagnosis, in patients who might not even know yet that COVID has delayed their care. And there's also that element of long COVID, which we didn't
Yeah.
actually touch on, but it does exist, and there's a lot of
Yes.
studies and research, a lot of concerns. Just
Yeah.
working in research as well, I know, people who have a lot of different conditions. Long COVID is something that's always being considered now because COVID does have a lasting effect for
Yeah.
people with chronic conditions.
Yes.
So yeah,
I think 100% that is an issue that I think it's still being researched because we don't know as much about it.
yeah,
I feel like even COVID, it's the fact that the lasting effects of it we haven't really seen yet because it hasn't really been gone for that long.
yeah,
Uh, it's, I mean, what was I gonna say? I think the first form of like the Delta variant and all
yeah,
that
the
was like
Delta, yeah,
heavy,
version,
and
yeah,
that's what actually was the cause of a lot of like the death and the everything that happened.
yeah,
Thankfully, it wasn't spread as easily,
mm,
so people don't see COVID as a threat really anymore.
yeah,
After all that, it's like, what do we do now? Where do we
yeah,
go from here? Healthcare workers obviously need real support, not just thank you for the great work that you did, or,
yeah,
why aren't you guys moving faster? Because at the end of the day, there's a limit. They're humans. We have to remember that. Granted, like doctors, healthcare workers can do amazing things for us, but they are limited in their powers. And
mm,
they need mental health resources. They also, like, I feel like a lot of places in the world, they don't get necessarily fair pay. I know it's argued that healthcare workers in general is seen as like an industry where, oh, you can make a lot of money. That's like at a high level as a doctor, yes. No, I'm not going to refute that fact, but that's not healthcare workers, right? Lab
yeah,
technicians, nurses,
frontline people, yeah,
online people, to even some extent I would say like researchers, they
yeah,
if in the healthcare they don't necessarily get like quote unquote fair pay, and staffing plans that don't leave like they need staffing plans that don't leave like one nurse or one ER doctor responsible for like 20 patients, and all overnighters and like 72-hour shifts or stuff like that. uh, but
yeah,
I think that remains an issue that we need to take care of them as well.
yeah, absolutely. And like, you know, because of the pandemic stuff, they didn't even have proper equipment too, right? They didn't even have enough like hand sanitizers or even chairs, I heard, like in hospitals. So like even the basic necessities were not even given to them, but they still stood up on their own 2 feet and did the work. Some even without complaining. They just knew that we had to get it through this phase. So yeah, they deserve that recognition and that support. And the system itself needs investment, not just emergency bailouts, but also long-term capacity building. What that really means is like, thinking about what could happen in 5 to 10 years from now if we have another pandemic. So we have to consider the pitfalls like surgical backlogs, converting that to better data, stronger
Yeah.
public health, and really better digital infrastructure that's accessible, but that also closes the gaps rather than widening them.
Yeah, and I think most importantly, pandemic preparedness can't fade once the headlines do.
Yeah,
So I think worldwide, healthcare systems, governments, WHO really need to think about what steps did we take that allowed us to be so delayed to
yeah,
a response on COVID, and how can we fix that? Because the question isn't if we face another global health crisis, but when, right? Because it can happen whenever.
anytime. Yeah, mitigation. We need a mitigation strategy. We need
Yes.
more preparedness, and I think their job is really not done at a public health level. They still need to kind of spend at least a decade reflecting on what happened, because like they can't be
Yes.
seen doing this issue, or this like seeing it exasperate to this extent again. We need to really contain stuff.
Yeah.
um yeah, yeah, so I think we've reached the end of our podcast. So just a quick recap. COVID has left deep scars on healthcare systems, stuff like burnout, backlogs, financial strain. We've talked about as much of it as we could, but it also sparked a lot of innovation, showed us where the cracks are, which was a huge thing, and it forced conversations about resilience, not just at a public level, but even on a community level, with patients and families striving to fight all these concerns.
Yeah, exactly. And these effects aren't in the past tense, right? They're still ongoing. And if we want stronger healthcare tomorrow, we need to start rebuilding our healthcare systems, our approaches today.
Absolutely. So, yeah, that's it for this episode of the Ash podcast. If you learned something new, share it with a friend, leave us a review, or connect with us on our socials.
Yes. And if you're a healthcare worker, a patient, or even a policymaker, because we'd love to hear about all of your perspectives on how you feel that the healthcare system or your system in particular is still rippling from the impacts of COVID.
Absolutely. We welcome all stories, all people. Please reach out, and we'd be happy to have you on our platform. Until next time, stay safe, stay informed, and keep advocating smart. Thanks for listening.